Dr. Andrew Iverson graduated from Yelm High School in Yelm, Washington. He has 11 years combined graduate training from the University of Washington in physiological psychology, medical botany from the School of Natural Healing, and a doctorate from National College of Naturopathic Medicine in Portland. His doctoral thesis and postdoctoral work have been focused on the effects stress and emotion have on the immune system and disease. He is a medical director of Trillium Health, a busy clinical practice in Tacoma where he specializes in a unique biochemical testing method to determine patient-specific nutritional needs. It also emphasizes the impact of thoughts and emotions on the physical health and focuses on chemical detoxification with botanical medicine, fasting, and hydrotherapy.
Thank you, Sarah. Wow. Kind of fun. It feels like Dr. Phil and Oprah a little bit. Great. Hey, so many great faces. I think we have people as far as from Graham and Olympia and as far north as Edmonds and Seattle. Bill, thank you for coming all the way from Yelm. So many patients' faces to see. It's so exciting. And we're talking about a subject that is by far probably my most favorite of all. Hi, Phil. Thank you for coming as well. This is the most important presentation I feel like I have ever given, primarily because it's been a fascination for me since I've been a young boy. The power of our brain to influence our body. And if we look at the perspectives of what that means, it means that the brain and our thoughts can do things that no drug, no surgery, no supplement can do. And that's what I want to share with you tonight. My house, if you could see it right now, has stacks of books from the library all around it for the last 3 weeks. You can ask my family. I've been surrounding myself with this information, and it's dense, it's thick. It's for some reason, I don't know why we don't know more about it. For some reason, we haven't necessarily tapped into the understanding that our brain and our mind has the capacity to do things that we potentially never realized. So let's talk a little bit about that now. And what we're going to talk about is the non-traditional approach to pain. So way prior to this time, in ancient time, and actually the father of modern medicine, Hippocrates, who probably would be shocked to see what happened to his legacy of medicine, said even in the year 460 BC, whatever happens in the mind influences the body and vice versa. Whatever happens in the mind influences the body and vice versa. In fact, the mind and body cannot be considered independent from one another. And of course, prior to that, in 900 BC, Proverbs, as a man thinketh in his heart, so is he. You see, the ancients knew things that just now we're beginning to prove is actually true. So these next couple slides are absolutely imperative that we understand them. If we don't, I'll spend a couple seconds more with it. But these are where the fascination begins. We are an endless pharmacy. We just need the keys to unlock the locks. Let's take a drug, for instance. Any drug you wish. A drug acts as a key inside your body. The reason why it's working is the drug goes through the bloodstream and it finds a lock. Okay, this lock is called a receptor. It turns the key and it opens the lock, and what you have is your effect. That's what's occurring here. These receptors are throughout the entire body. Now, tell me, why would we have these locks in our body if there wasn't a reason for our body to be able to open it? As far as I'm concerned, I didn't think Mother Nature was ever planning to grow a tree with some form of pharmaceutical like Prozac or Ambien on it, as far as I'm concerned, right? You see, these receptors, these locks, are inside of our body because there must be a way for our body to unlock them. And one example here is morphine. So morphine, which of course we recognize as a painkiller, acts on these receptors, and it opens them, and what we have is a reduced signal to the brain, which means pain relief. Interestingly enough, later it was discovered an endorphin, endo means inside, orphan means morphine, which is the morphine within the body, bound to these receptors that the opiates are bound to. Endorphins are made by your own body. Opiates bind onto them, but truly these endorphins were meant to bind onto them, and they give the sensation of what runners might call the runner's high. They're also greatly elevated during sexual peak during orgasm. So, what are the keys that unlock the locks? They're called neurotransmitters, and they're often neuropeptides. These are the words that the nervous system uses to communicate. Substance P, for instance, which we're going to be talking about quite extensively, is the chemical that the body uses to say pain. A little Latin here, neuro, which is, of course, means nerve, and peptide, which means protein, were once thought, the reason why they call them nerve protein is because they thought they only existed in the nervous system and in the brain. But now we recognize they're throughout the entire body, as well as their receptors. And it makes sense if we think that every single cell in your body has the DNA to create every single cell in your body, and the DNA to make every single chemical in your body. It makes sense that these receptors and these keys should be able to be used throughout the entire system, not just in the brain alone. I just want to go back here. Dr. Candace Pert, if you've heard about the book Molecules of Emotion, she's been on many talk shows. She's the pioneer of where much of this came from. What the bleep as well. Okay, so we're not going to get too much into technicality because we're going to get to the fun stuff here in just a moment, but it's really important that we recognize what these neuropeptides are all about. Now, amongst all the volumes of the books inside my house right now, I started digging through these neuropeptides, and what I found was so interesting is that all of these neuropeptides, and some of them you are quite familiar with the names, such as adrenaline, we know that name, serotonin, melatonin, histamine. Some of us, we just learned about endorphins and substance P. Interestingly enough, all of these neuropeptides have dual capacities. They do not just work in one element of the body. When you look them up, you will see that they have a physical function, and the brain also uses them as words for the psychological body. For instance, first of all, those listed in red are those neuropeptides which play a very strong role in pain. And you can see there's multiples of them. And if we go to serotonin, for instance, most of us think that serotonin is the neurotransmitter in our brain which is required to keep our mood stable. And of course, as we see right here, it is for our mood. It's to keep us happy and light-hearted. It's also for sleep balancing, and it's also for when there are aggressive behaviors, there tends to be an imbalance of serotonin. But how many of you knew that that very same language which the brain uses for emotional balance, it uses to send a signal to vomit inside your gut? How many of you knew that same language the brain uses to modify your emotions? It uses to activate pain. It uses to activate your temperature and sexual activity. So you can start to see how some of these neurological chemicals, which we use from everything from emotional factors to physical factors, they have dual capacities. A lot of patients will say, so you're just saying this is in my head? Well, yeah and no. The limbic system, which is this part right here, it's deeper inside your brain. This is the part where science has proven that you feel sad, that you feel depressed, that you feel ticked off. This is where you feel it. When you feel it, it lights up in these zones. What Dr. Pert found out, and this is so important to understand, that those neuropeptide keys, those keys that are released through the entire body, 90% of them have receptors right here in this spot. 90% of the neuropeptides that are available in the body that do everything, every single transmission in the body, have a connection to the place where science has proven that it feels emotion. I came up with some good pictures, didn't I? I like some of these. You can laugh, you can say they're good. Yes, it'll make me feel better about all this work and the last 3 weekends of not doing anything. That's good. This is a fascinating slide because this really ties it all together, and it's the most important thing that we understand before we move forward, and that is your thinking mind. The one that we think we use, which is we think it's this thing up here, right? Is no longer isolated to your head. The thinking mind, because these neuropeptides are found throughout the entire body, is actually the entire body, which means we have a body mind, mind-body. Because of this, the emotions cannot be separated from the physical. In fact, a thought is physical. It is a chemical transmission. It is a real thing. It is not imaginary. Your thoughts are real chemicals. And as Dr. Pert put it, emotions are literally real physical molecules translating the real mind into matter. That is so important that we understand that. That literally your thoughts are not just ether. They are chemicals that is transmitting throughout the body. Okay, I think this is probably one of the most fun parts of this presentation because placebo effect has been something that has been absolutely intriguing to me for most of my scholastic years. Placebo effect. How many of you have heard of it? Just give me little hands like this. Great. Okay, so for those of you that know, placebo comes from the Latin placere, which means I please, okay? The placebo effect is when we pair something with, let's say it's a substance that has absolutely no medicinal value, and we give it to our patient and we tell them, this is a magic medicine that comes from very far away, and it's going to take care of all your ails. And guess what? Voila, the doctor gave me a magic medicine, and it's like a genie in a lamp, and they're better. But there's absolutely no medicinal qualities in this at all. Now what's fascinating is science has been trying to get rid of this placebo situation for a long time because it screws all of their studies up. It really does. And the real practicality of it is this placebo effect is the medicine that we've truly been looking for. In the perfect dosage, never an overdosage, and guess what? It's pretty darn cheap. Maybe that's why we're not looking for it too much. Basically, the placebo effect is your body creating a real response. It's a real response by releasing your own pharmacy of chemicals in response to the intention of the thought. One more thing before I go on here. I talk to many of my patients the difference between belief and knowing. If a cardiologist was to say to you, you have two of them actually, one of them says, you know what there? I believe I can take care of that heart for you.
I've heard that.
And you have another cardiologist that says, you know what? I know I can take care of that heart for you. Which one do you choose?
No.
So therefore, the placebo effect has an element of not belief, but of knowing. That is the key for the placebo effect. This brings up one of my most favorite discussions on placebo. I dug this up when I was doing my doctoral thesis on the mind of cancer and how cancer is affected by our thoughts and our mind processes. This is actually a study which is considered completely unethical and completely unable to do anymore. We have several patients, I don't know how many there were, that were told they were going to have open heart surgery, but instead, the doctors took them into the room, got them all dressed out, anesthetized them, cut open their chest, opened them up, closed them back, stitched them up, and didn't clean out a single artery. Subjects in the placebo group, remember this is the one we're trying to get rid of, 90% improvement, including less anginal pain and reduced need for nitroglycerin and total tolerance for exercise. Is that weird? Does it not excite you as much as it excites me? I mean, seriously. Okay, this is another powerful one, Deepak Chopra. How many of you know about Deepak? One of my favorite heroes of all time. Dr. Chopra was a medical doctor, and he was tending to a woman that was complaining of stomach pain and jaundice, which is a yellowing of the skin. And he figured, this lady must have gallstones. And of course, this was before the time when they run regular CT scans on everybody that walks in the door, and that's why our insurance rates are going out of nowhere. It's another political situation. But he sent her in to have gallstone surgery, and the surgeon opens up, and they found this woman was full of malignant cancer. Stitched her back up, let Dr. Chopra know, and Dr. Chopra went and told the daughter, and the daughter said, please do not tell my mother whatever. If she only has a month to live, I want her to live that month in calmness and tranquility. So Dr. Chopra said, patient, your gallbladder surgery was a success. She leaves and comes back 8 months later, completely well. Not a sign of cancer in her body. Dr. Chopra was shocked because the physical exam showed nothing. And he asked her, he said, you're so well. And she said, ever since I had that gallbladder surgery, I just knew I was going to be better. And the cancer never returned. And that is from his book, Quantum Healing, an excellent book on this topic. Pseudocyesis. This is a fascinating conversation as well. Another powerful effect of the mind. Pseudocyesis is when a woman is so desirous of having a baby that she, through her mind and her body, creates the presentation of a pregnancy. And this is included with a stomach that expands like we see in pregnancy. We have a ceasing of the menstrual cycle. The uterus enlarges, the cervix softens, the breasts increase and secrete milk, and the woman even feels a baby quickening inside of her. 1% actually go to labor. Now, you might have heard of the story of Bloody Mary, I have your baby. Something that children do, of course, in the mirror, and it's about Queen Mary of England, the daughter of Henry VIII. She actually had 3 false pregnancies, and they feel that the reason why she was so rampant in her murdering was because she was completely distraught of not having these babies. But to imagine that we have the capacity to create these hormonal fluctuations purely by wanting and desiring and knowing that we're pregnant. So, if we have a placebo effect, which is for the positive, we must have a nocebo effect, which is for the negative.
And this is commonly seen in our society where the doctor will say to their patient,
you know what there, buddy? Sorry to tell you, Al, but you got 3 months left. And guess what? They die on the 3-month day. This is called a nocebo, and they are just as powerful as a placebo. It is the negative in response, and doctors can be either placebos or nocebos, so you be very careful of the doctor you're choosing. And the reason why I put a little voodoo doll up here is because it's very much understood now that nocebos and voodoo dolls is probably the reason why they work, is that the people that have a hex put on them are so much in knowing that they have a death sentence that they can create amazing physiological changes in their body. Stress is real, It's not just something that we think is, oh, I'm stressed out, oh my gosh, I got this and this going on, but it is a real response, fight or flight. You've all heard of this, I'm sure. But what happens in fight or flight you may not have heard about. This is a chemical reaction. When you are in a state of fear, adrenaline and cortisol are secreted by these glands on the top of your kidneys. And what they do is when they're secreted, they cause several things to happen. Number one is they increase your heart rate, your blood pressure, and your breath rate to increase your blood flow. And in the clinic, often I will look at patients' resting pulse and see if they're above 72 per minute. And if that is the case, we know there could be an element of stress. Pupils dilate. The blood vessels in your skin, for those that have cold hands and feet, consider that you are in a constant stress response because your blood is going into your muscles so you can run from the bear. The same thing, we look at the digestive system. The digestive system as well will be compromised in its blood supply. People that have had chronic constipation, usually those that are starting at a very young age, we have to ask if they were exposed to fear and anxiety at a young age. Because in fear and anxiety at a young age, that blood will flow from the intestines into their muscles and they'll have chronic constipation. You know the old story, cold hands, warm heart? Well, it's really true because the blood is going from your hands into your heart. As well, the blood sugar increases in order to provide more energy to run away from the bear, and of course the immune system decreases. And we've heard of the great acts that mothers can do when their baby falls below a car. They're able to pick the car up, and that is due to the power of adrenaline surging through the system.